Hi, I'm Dr. Patrick Abbey with the Maxillofacial Surgery Center in Tampa, Florida. And this is a brief video, an overview of wisdom teeth. Your wisdom teeth are essentially an extra tooth in your mouth, or as we classify it, your third molar, which is present as a replacement should a tooth in front of it be lost at an early age. Nowadays, with fluoridated water therapy, widespread dental care, most of the patients we see in our office in their later teen years don't have as much as a single filling in their mouth, much less the thought that they've had a missing tooth that needs to be replaced. It's great for dental care. Unfortunately, it leaves the wisdom teeth typically in a position where there's no space for them to erupt, or there's only room for them to partially come into the mouth, and this creates the problems that we see with wisdom teeth as the years go by if nothing is done with that. The problems that has been documented in the literature that can lead to involve periodontal issues with the backside of the second molar, which is a functional and necessary tooth for your chewing, as well as decay and increase in cavities, recurrent infections, and problems with those infections then spreading and becoming more serious as they begin to develop around the impacted wisdom tooth. There's also a low percentage of patients that would see cyst development and pathology that can be there with an impacted tooth, which obviously would necessitate treatment as well. We can typically distinguish room for the potential eruption for the wisdom teeth, as there are a small percentage of patients where there's enough space in the jaw for them to be able to come in with a simple screening x-ray similar to this, where we have a layout of the jaw structure. We can do appropriate measurements and space of the actual wisdom tooth, which is impacted itself in the room that's there in the jaw, and make a decision in conjunction with your general dentist or potentially orthodontist if the patient's in orthodontic care as to the necessity for their removal. If the removal appears to be indicated, then we would begin to discuss how that surgery would be accomplished on an individual basis in discussion with the patient or potentially their parents. Typically, that surgery is done in an outpatient basis within our office, where we have a fully equipped surgical suite and is performed under technically an IV sedation. To the patient, this will feel as if they briefly went to sleep for a few seconds, which is how our typical patient would describe that feeling. The modern day medications and techniques for that anesthesia are very safe. The patient is appropriately monitored throughout the course of that procedure, and we have precautions for any type of emergency care that might be necessary. The medications that our office typically employs at this stage would have very low interaction as far as any post-op complication involving nauseousness or any type of reaction to those medications, and that could be discussed at length in the office in deciding the best route of treatment. The surgery typically involves 2 to 3 days of some minor swelling afterwards, which resolves rather quickly, and the patients are typically back to their normal routine and activity within a week following the extraction. This is obviously patient dependent and somewhat dependent upon views on the x-ray, which is also discussed on an individual basis. We would be more than happy to see patients for consultation in that regard and have that discussion as necessary, or answer any further questions upon visit to our office. Thank you.